Okay, I'm going to show you how to do the snap test for foal's blood. Usually it's done about 12 to 24 hours after birth. I prefer to do it 18 hours after birth because then you get the best results. You got two bags. In one bag you have two solutions, and in the other you have the kit. One solution is the diluent and the other is the reagent. You put those down, and then you have two of these sticks that you're going to be using to take a sample of the blood and put it in the diluent. So you open the snap test kit, and this is just to keep out the humidity, you don't need it. And you take the snap test kit and you put it on the table, and you have to make sure it's a leveled surface table. Then you take the blood and you kind of wiggle it around, so it's supposed to be in a, I don't know if you can see this, it's a purple top. That means it has EDTA in it, anticoagulant material on the glass, so the blood doesn't coagulate. Then you take your two probes and your diluent. What you do, you open your diluent, you open the first cap, then you open the second cap. You have to snap it off. This is the motion. So you snap that off, you put that to the side, and what you do, like I said, you shake this EDTA a couple of times, and you pop the top off, and then because you shaked it a couple of times, a couple of units of blood will kind of be stuck to the top. So you take these tubes, and we're using whole blood. You can do plasma, you can do serum, but we're using whole blood, and you use two of these if it's whole blood. So you use one, you see that it's clear, and then you use the other one. They have a kind of a hole on the edge of them, and that's supposed to get kind of filled with the blood. It's made in a way that physically it's like water attracts to water. Okay, now that we have the blood in there, make sure the blood is in there, we can close this up, put this aside, put the cap on the diluent, the first one, then you take the second cap, you twist that on, and you shake it for about 5 times. Now that we know it's mixed together, that is the samples of whole blood that we put in the diluent, we take the diluent and we take the first cap off, and I just put it in here because I don't have any other place to put it, and we kind of dispose of 10 to 12 drops. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Anyways, and then you put 1 drop, I don't know if you can see this, 1 drop, where with the kit you will get an explanation where all the dots are, but if I'm holding the kit towards me with the snap writing towards me, I would put 1 drop, this is important, I would put 1 drop where the area closest to me is, that has 1 blue circle. It's not complicated if you have it with you. So you put it on the table again, and you put 1 drop in there. It's important that it has to wet that spot, because if not you have to use another kit, but it hasn't happened to me that that spot hasn't gotten wet. Then you take the reagent, kind of hard to twist off, and it's blue, and you put it at the, if I'm holding the snap test to me again, I'll put this on the table, you put it at the last chamber of this snap test, and you put all of it inside. Okay, and in a matter of 60 to 90 seconds, this is blue, and there's some left, don't worry about that, but try to put everything in. The blue solution will rise up to the hole that is closest to the where it says snap. Again, if I'm holding it towards me, the snap test. And once it reaches there, you push down as hard as you can. Good. Now that we've pushed down, you have to wait 7 minutes and read the results. This is how you do the snap test. It wasn't very clear to me. This is why I'm making this video. So, you all can have it.